Hello, everyone. I'm Dr. Himani, and today we are going to talk about how ABA therapy works and how it helps our children. So, ABA is one of the most scientific and evidence based therapy. The principles of ABA are used for improving the child's performance. It helps in developing speech and communication and also in teaching the life skills. ABA principles generally increase socially acceptable behaviors and tend to decrease socially unacceptable behaviors. So it works mostly towards increasing the appropriate behaviors and decreasing challenging behaviors. So, but to work on ABA based principles, we need to keep something in mind. We need to have a baseline assessment of the behavior for the child. So, how long can the child sit? How many words the child can speak? What is the behavior which is interfering in their learning? And then set some achievable targets. So, it's very important to do a baseline assessment and then form a specific program for particular child. In ABA based intervention, the child is mostly motivated to learn rather than forced on to learn. So it's very important to identify the real cause of the behavior, how frequently that behavior is occurring, what is triggering the behavior, how is that behavior interfering, and what is the consequence. So when we keep all these points in mind, then we can actually address that behavior and manage in reducing that unwanted behavior using the ABA techniques. So, two most important principles which are seen in ABA are motivation and positive reinforcement. So, ABA can be used across age groups, all age groups, from early childhood to till adulthood. It has very clearly defined teaching goals, and we take a lot of data on the intensity of teaching, how many days are taken to master a particular goal, what are the type of prompts which are available, what are the behaviors which are seen, and then working on generalization of the acceptable behavior across various settings. Periodic assessments are required when we are running an ABA program, and the program is modified from time to time according to the need of the child and how the child is learning. So, a minimum of 40 hours per week of ABA intervention is recommended. And in a lot of studies, it has been shown that if you do the recommended duration of ABA intervention for at least 2 years, by the time a child is 7, 8, or 9 years of age, they are functioning age equivalently. So that is something which is a huge evidence which tells us that yes, it is one of the scientifically most researched intervention for managing children on autism spectrum disorders. Now, there are some of the myths which are prevailing amongst parents and amongst the caregivers about ABA. Those myths have to be erased. Some of the myths are like kids turn it very robotic, or children are dependent on food. That's completely a myth. There are various reinforcers which can be used other than food also. Also, a lot of time parents feel that it treats only the behavior and it does not focus on language, which is not true. It does work through behavioral methods in teaching various language skills. And some parents have this myth that it works only for older children and it's not an intervention to be used for very young ones. But again, that's a myth and it's not true. It can be used across from early childhood years, like 18 months onwards till adulthood. So, behavior modification, again, to reinforce, is a very, very scientific and evidence based method of managing children and teaching children on autism spectrum disorder. And if you have any concerns regarding ABA intervention, please feel free to reach out to us at Continua Kids. The details are in the video below, and you can reach out to us at any point. Thank you.